questions? I've got one question for Christian. What's your return to sports? Do you make a difference between acute and chronic groin injuries? Because here at Aspetar we especially see a lot of acute groin injuries. Is that the same story what you told here, or is this more for the chronic injury?
The example was for an acute, but yeah, I wouldn't. I'm not sure whether I'm not sure. It's a very difficult measure, I think, and I probably would be more happy with just the fact that when they're the level that the PA question in the hip and groin outcome score, because those two questions actually you ask whether you're able to perform at your normal level and whether you can. That's one question, and the other one is whether you're able to perform for as long as you can. And I think that's probably what we want to aim for, is to get as high scores as possible. So I would probably go more for that one on the chronic one. But again, I think we should not give up on the return to sport, but I think we need to really rethink that, because I think there's some cavities in there that just doesn't tell us anything.
Yeah, thank you. Was one question? Is the final one?
It's also for Christian. Do you use the Hago score also for predictive?
No, we haven't done that. I mean, it looks as if it can predict something, and there are previous studies using similar scores. That's where you can actually, with the Hagers, it seems that if you get a low score below 80, I think that was for hamstring and groin, that there seemed to be an indication that you are then at an increased risk of getting a groin injury. But that was not using our score. But I would suggest that if you have a very low score, you're also in that group with the previous injury as well. So I think this score would probably be able to pick that up as well. If it's better or more, I wouldn't know. But no, it's a relevant question.
Okay, final question.
As you described that adductor lines has an anterior tendon and posterior has a muscle. This is can interfere the return to sport or not?
Whether that has implications for return to sport?
Yeah.
Yeah, I would probably still say that my assessment would still, I would not have any sort of general opinion on when people would be back. I would much rather prefer to do specific measurements and then set up criteria for when I think it's a reasonable time to be back, because I think we have to be careful, even though the anatomy might be different from other tendons. I still think it would be better to, I mean, we're doing MRIs, we're doing radiology, why not do a strength assessment as part of our assessment of get an idea when a sound time to be back will be. Does that answer your question? So I'm not sure of the implications. We don't know.
Okay, thanks for the speakers. And we just had a quick discussion within the committee regarding the slide Christian showed, because we learned from that Professor Helmies only agree with himself, but but hopefully we agree with his final words of this day. Thank you.